Chapters 24 to 34. Match the two parts of the sentences. Look at A, B, and C opposite to help you. Number 1, 1988. So the UK launch of Live Attenuated. Letter J. Measles, mumps, and rubiola. MMR vaccine. Number 2, chickenpox, varicella, is a common infectious. Letter E. Disease of childhood. Number 3, rabies has an incubation. Letter A. Period ranging from 4 days to many months. Number 4, the patient remained febrile. Letter H. With peaks of temperature of 39.5 Celsius. Number 5, he was admitted with a 4-day history of influenza type. Type symptoms of fever with letter B. Rigors, malaria, and general malaise. Number 6, quite a proportion of patients who recover from hepatitis B. Letter C. Become carriers of the virus. Number 7, the central part of America is in the midst of an epidemic. Letter F. Of AIDS. AIDS. 8. Measles, rubiola is most. Letter D. Infectious during the catarrhal stage. Number 9. Lyme disease is caused by transmission. Letter G. Of B. Burden from animal to man. Of exotic ticks. 10. PUO stands for letter I. Pyrexia of unknown origin. Complete the case report of the patient in A opposite. Look at A, B, and C opposite to help you. Case 45. On examination, he looked unwell. His pulse rate was 100 per minute. He had a palpable spleen. The combination of fever and rigors in a patient who has recently returned from Africa strongly suggests a diagnosis of malaria. The incubation period is usually 10 to 14 days. In this case, the patient admitted he had not been taking prophylaxis regularly. The diagnosis was confirmed by the presence of parasites in his blood film. Complete the sentences. Look at A, B, and C opposite to help you. Number 1, an infection which can be treated successfully with antibiotics is curable. Number 2, another word for an epidemic is an outbreak. Number 3, bacteria and viruses are examples of microorganisms. Number 4, someone whose temperature is normal is a febrile. Number 5, the common infection with Epstein-Barr virus is known as glandular fever. With the table word from A, C, D, and E opposite. Noun, affect. Adjective, affective. Anxiety, anxious. Behavior, behavioral. Dementia, demented. Disturbance, disturbed. Suicide, suicidal. Make word combinations using a word from XBus. Two words can be used twice. Look at B, C, and E opposite 2. Behavioral syndrome, eating disorder, major depression, mental retardation, personality disorder, psychomotor retardation, sleep disturbance, substance abuse. Complete the sentences. Look at A, B, C, and E opposite to help you. Number 1. The way a person behaves is his or her behavior. Number 2. A persistent emotional state is a mood. Number 3. A sudden attack of anxiety is a panic attack. Number 4. The form of dementia associated with aging is called senile dementia. Number 5. A disorder which is not associated with pathological changes is functional. Number 6. An idea which forces the patient to repeat unnecessary actions is a compulsion. Which symptoms of depression was this patient suffering from? Look at the opposite to help you. Case 41. A 56-year-old woman presented to her GP complaining of increasing tiredness over the past few months. She had lost interest in most things. She was sleeping poorly and tended to wake up early, but denied any suicidal tendencies. She was thirsty and was passing urine more often. She was eating normally and her weight was steady. Symptoms. Number 1, tiredness, fatigue. Number 2, loss of interest. Number 3, sleeping poorly, insomnia. Complete the table with words from A, B, and C opposite. Adjective, blind. Noun, blindness. Conscious, consciousness. Deaf, deafness. Dizzy, dizziness. Numb, numbness. Lightheaded, lightheadedness. Unsteady, unsteadiness. Make word combinations using a word from each box. Look at A, B, and C opposite to help you. Double vision, epileptic fit, protomonal symptom, syncopal attack, urinary incontinence, visual acuity. A doctor is trying to determine the cause of loss of consciousness in a 52-year-old man. Complete the doctor's question. Look at the opposite at the table in 26.1 above to help you. Did you lose consciousness suddenly or gradually? Did you get a warning of the attack? What were you doing before you passed out? Were you worried or under any stress at the time? Did you feel dizzy or lightheaded before the attack? Did you lose control of your bladder? Did your wife notice any involuntary movements while you were unconscious?